talk too much. It's for the speakers, to deliver the talk today. Just to give you what this event is all about. So, we started a magazine called Healthcare Executive about 4 or 5 years ago. The first two, events were a golf tournament, by the way, not a thought leadership summit. And it was a logistic disaster. Because to get people 6 a.m. in a golf course was not very easy. And then we thought that we will launch something which is very different, which is more innovative and which throws up ideas which help us all in various spheres of healthcare in India and anywhere else as well. So we tried to search topics, speakers, and bring about ideas which others can follow. This is not going to be a very specific format where you see too many PowerPoints, thrown at you, things like that. So this is going to be sharing of experiences of people who have made a difference. The way they have done things in their profession, in their workplace, whichever way you look at it. And we think that it was important to do something like this because India is on a cusp of, its healthcare revolution. In the sense that maybe about 2 weeks ago, I was in a similar kind of platform in Chennai, and there was so much which was spoken about how healthcare is changing, and from maybe brick and mortar, you are looking more toward digital. Okay, with many companies which are coming up with products which are very different, and which will probably not replace hospitals, but will change the way people approach healthcare. Practo is a very common example. Is from your hometown of Bangalore, and Bangalore is known for a lot of software development. Similarly, there may be many other areas which we need to perhaps look at healthcare differently. Okay, for example, India doesn't have a very mature healthcare insurance, so that becomes a problem. Because people need to buy. No, I don't need that. Not today. How do you purchase healthcare? It's not going to be that very easy for people to avail healthcare if they fall sick. Cancer, for example, is kind of a disease which it afflicts you. It can really wipe you out because apart from radiation therapy, chemotherapy, oncosurgery, if I throw statistics at you, we have maybe about 450 linear accelerators in the country. We need 1,500. So maybe, as they say that what cardiology did to healthcare, oncology will do in the next maybe 5 years. The way it will change, and every hospital probably will go for it. But technology, very expensive. So today I think we're going to share thoughts with some of the leaders of how they have gone about doing things differently. That's the motto. So if you look at it, it's about inspiration, it's about innovation. Okay, it's going to be more focused on that. There will be, in the end of every speaker, you could have, some questions, maybe about 5 minutes of that. We will like to keep the time. We generally manage to do that, till now we've been successful. So we will like to do that. So even if you ask questions, be careful that we don't override the theme, the basic thing. Let's not deviate, and ask some questions which are not relevant, to what has been spoken about. You could do it offline when we are having lunch or any tea break or anything of that sort. Though I know that I have to thank in the end, but thank in the beginning also all the support that we have received. Names are displayed here, and some of them are really trying to do something very differently, which probably is going to change the way technology has been brought to Indian hospitals. So we'll hear from them as well. Also, we have this program being recorded by NDTV, and we will follow this up. After about 2 or 3 weeks, they will be telecasted on NDTV Profit Prime. So with that much, I think I will hand over to my colleague, and please clap.